Good afternoon, and thank you for joining us today. A lot has happened over these last few days, and it's fair to say that our region is being tested like it's never been tested before. Before we get into the basic updates, which we'll have from Supervisor Fletcher and from Dr. Wooten, I also want to acknowledge that we have two very special guests with us, which will be available to answer any questions dealing with the situations at San Diego State College. I graduated from San Diego State College at San Diego State University. We have honored to have with us Dr. Andrea Dooley, who is the Associate Vice President for Health, Wellbeing, and Accessibility, and also Dr. J. Luke Wood, who is the Vice President for Student Affairs and Campus Diversity, and they will be available later if there are questions coming up with the San Diego State University campus. We've been dealing with the ongoing coronavirus now for, almost 6 months. And obviously a lot has happened over these last few days, but certainly one of the biggest issues right now that we're dealing with is the wildfires that have blackened our scenic backcountry and polluted our blue skies with smoke and ash. We cannot thank our firefighters and first responders enough for their courageous battle against these fires and for doing so during some of the hottest days that we've experienced this year. The fact that we have not had any deaths so far is a testament to the work of CAL FIRE, our local firefighters, and our military pilots who have flown numerous times delivering retardant and water, fighting these fires from above. It's also a demonstration of the vast improvements that we've seen over these last few years to our region's emergency preparedness and our response systems. And I want to thank our Office of Emergency Services and their staff for the work that they're doing. It's truly been an outstanding effort on the part of all people involved. It is that preparedness that has allowed us to handle 2 emergencies at once. When we started planning for fire season, we wondered how we could safely evacuate and shelter people while keeping social distancing in mind because of the pandemic. We took the lessons learned from the pandemic and we have used hotels to shelter people. Working with the American Red Cross, we've identified hotels and booked rooms for evacuees. Those who didn't have a place to go were given rooms, and so far we have over 300 people using those rooms. Some people declined and preferred to stay at temporary shelters or evacuation sites, and some are parking using their own RVs. Our public health nurses are working with the American Red Cross to screen evacuees for COVID-19 and ensure that evacuees are wearing facial coverings and practicing social distancing. Also, the incident management team has developed a Wildfire COVID-19 screening tool that is being used to screen first responders and provide guidance on what to do with an individual exhibiting symptoms. But let's be clear, we're not done yet with this fire and the others that may come during this fire season. September is National Preparedness Month, and I urge all of you to put together a personal disaster plan and talk with your family about what to do during an emergency. You can get more information at readysandiego.org. Let's all get prepared and remain vigilant for whatever comes our way. With that, we're going to move into our regular update on the coronavirus. I want to start with some good news and let you know that FEMA and Cal OES, or the California Office of Emergency Services, have extended the popular Great Plates Delivered program through October 9th. This program provides meals to seniors who are among the most vulnerable to the effects of COVID-19. Participants are paired with a local restaurant and receive 3 nutritious meals a day. We currently are serving more than 2,700 people, but we can serve more, and we encourage eligible older adults to call today. And remember, the County of San Diego also established the Great Plates 2.0 Dinner Delivered program. Great Plates 2.0 provides 1 hearty meal a day to adults of all ages who are living with a health condition or disability that makes it difficult to prepare or obtain meals. We are currently serving 280 people in Great Plates 2.0, and we can also enroll many more people for this program also. To learn more or apply, please visit www.aging.sandiegocounty.gov or call the Aging and Independent Services Call Center at 1-800-339-4661 and select option 7. Now we're going to move on into our updates today, and we have, again, 2 special guests from San Diego State University who will talk about the COVID cases there. If there is questions, it's Dr. Andrea Dooley and Dr. J. Luke Wood, who are both vice presidents at San Diego State University. With that, I'm going to introduce my colleague, Supervisor Nathan Fletcher, to go ahead and give us an update.
Thank you and good afternoon. I also want to extend my appreciation to our firefighters and first responders that are confronting the wildfire situations we face, along with my appreciation to the staff at the Emergency Operations Center who continue to respond to the COVID-19 pandemic and the wildfire simultaneously. They train for this, they prepare for this. If we have a third simultaneous disaster, we will deal with that as well. But our appreciation goes to all of those who are working very hard to keep San Diego County safe. Real quick, yesterday the state came out and released the updated numbers with where we are. We saw our case count sitting at 6.9, which has us in the red tier. And now that we have the new system put out by the state, I just want to reemphasize that in order to move from one tier to another, you need 2 consecutive weeks of data in that tier. And so if we saw a significant increase or a slight increase over 7, we would have to be there for 2 consecutive weeks before we would officially move into the purple tier with the changes and restrictions that go with that. If we saw a massively significant decline, then we would also have to be in that next lower tier number-wise for 2 consecutive weeks before we would officially move there and have restrictions change. So right now we are in red. The state outlined that yesterday at 6.9, and any change we could stay in red for a considerable amount of time. We could potentially move up. We could theoretically move down. But again, you have to have 2 consecutive weeks of data in that higher or lower tier before you officially move and the changes in posture take effect. And so I think that that's important to keep in mind. We do continue to work with the state around testing data. The state is going to be using our testing data and results to reflect on their website until such time as the technical glitches can be corrected between the 2. And we'll continue to work with them on issues around testing and possible variants around case count based on testing and other issues. We will work with them. I do want to point out we are at 6.9 for our case rate, which means if we go up 0.1%, that's 7, that would begin the clock counting on that higher tier. And that is a situation that we want to avoid. Obviously, we have a lot of things going on in San Diego County. We have kids beginning in some limited capacity to go back to K through 12 education. We have our institutions of higher education that have their students back. And I want to thank Dr. Dooley, I want to thank Dr. Wood, and I want to thank the San Diego State team. They have a very difficult job in terms of what they're doing. They have good protocols, procedures. They're cooperating fully in testing and contact tracing. They're being very transparent and taking action, and we appreciate that as they work through what is a very difficult situation. But we have schools coming back. We just had a major holiday this weekend, and we have a number of businesses that were reopened just about a week ago for more type settings to be open and available. With all of those things going on, each and every one of us have to redouble and recommit ourselves to doing everything we can to slow the spread. We want to see our case counts go down, not go up. We want to see our percentage of positive go down, not go up. And in order to have a shot at doing that, it is going to take an incredible effort on the part of each and every one of us to utilize face covering, physical distancing, hand washing, avoiding large indoor settings. But we need to do that as a region, and we need to do that in order to have a shot at continuing our forward progress and staying in a good position. And so we take seriously the challenge in front of us, and we continue to implore the public to remain vigilant in spite of all the challenges we face. With that, I want to give an update on 2 testing-related things. The first is some new additional testing opportunities that are available for no appointment necessary. These are drop-in testing locations. We have 4 of them, which you see on the screen right there. One in North Cal State University, San Marcos, VSAT Engineering Pavilion. We have one in North Central University of San Diego parking lot, one in the Central Tubman Chavez Community Center, one in the East San Diego State University parking lot, 17B, and 2 in the South, Mar Vista High School and San Ysidro Port of Entry. You can get details. These are all open either 5 or 7 days a week for the majority of the day. If you go to 211sandiego.com, You can get more information on the exact address, specific location, along with the days that they are open. But each of these, again, are no appointment needed. Anyone in San Diego County who would like to get tested can feel free to stop by any one of these locations, and testing will be available to you. We've continued to work to increase our speed, our turnaround time, and our capacity, and we have the ability to expand our no appointment county testing sites to provide more testing to the general public, and we encourage those interested to please utilize these sites or the other sites through the existing 211 San Diego site. We also have made progress, if we go to our next slide, around our lab processing time. So our hospitals continue to do great. Public Health Lab, Helix partnership, again, those are pretty consistent throughout the past few months, and turning those around quickly, which really is vital to the contact tracing and case investigation process. But we've also seen considerable progress in the state's walk-in, let's get tested lab. They're now down to 1 to 2 days. That is a significant improvement. FQHC clinics continue to do well at 1 to 2 days, and our commercial labs are doing much better. It was not that long ago that those were up significantly, and they've done a good job to catch up to increase the speed at which testing can be turned around. With that, let's jump into today's report. You'll see today our 7-day average of daily tests is 6,339. Percentage of positive is 4.5, and again, total tests reported just under 900,000 tests. Contact case investigations, contact tracing, again, in a good position of our metric of over 70%, but both are in excess of our stated goal, which is over 90%. Total case investigations performed there, you see at the bottom, 46,481. And then on the right, you see our treatment cumulative number of folks in public health rooms, 7-day average, along with convalescent plaza, over 2,000. For today's positive cases, today we're reporting 247 positive cases out of today's total of 4,556 for a 5% percentage of positive. In the purple line there, you see our rolling percentage of positive average. We'd like to see this number preferably be declining, at a minimum staying flat, and this represents a little increase we've seen over the last 2 weeks in our community spread and transition, and that's why we continue to really implore everyone to be very vigilant as we move through these crucial next few weeks. Daily hospital census remains pretty static, basically where we were a week or down a little bit from 2 weeks ago. 96 COVID-related in ICU, 271 total COVID-related hospitalizations, so that number is encouraging. Total hospitalizations, you'll see COVID on the bottom at 271, non-COVID at the top. Again, holding reasonably steady and flat, about where we were a month ago. It's dipped up, it's dipped down, but again, holding below that 80% threshold, which is one of our metrics. My final chart today is our ICU utilization. You see our COVID-related ICU in the bottom, non-COVID there, again at 62%, holding relatively flat and stable, more or less, on the trajectory we've been for the past month. That concludes my section of the report. I'll now turn it over to Dr. Wooten for her Public Health Officer's update.
Good afternoon, everyone, and thank you, Supervisor Fletcher. Today's local statistics for San Diego County are from reports of 11:59 p.m. yesterday, which is Tuesday night. Therefore, today there is a total of 41,324 cases, which is 247 more cases than yesterday. And this is a slight increase in new cases since yesterday's report of 211 cases. This shows, the next slide, shows the epi curve with the daily cases by episode date, primarily including onset of illness. With a drastic decrease in cases after the restrictions that were imposed in the next slide. In mid-July, we saw a significant decline in the number of cases. But for the first 2 weeks of August, there's been a slight increase. The last 14 days, we expect to see more cases because that includes the incubation period. This overall number of cases includes 721 deaths, with 12 new deaths reported since yesterday. If you can go back. One more, thank you. The age range for all of our cases is the same, 3 months to 102 years of age. The age group from 20 to 49 years of age remains at 58%, represented by 24,094 cases. 21,179, or 51% of the cases are female, and 20,035, or 49% of the cases are male, with only 110 individuals having no gender identification. 3,237, or 8% of cases, have been hospitalized. 773 of those hospitalized have been admitted to the ICU, and this number is 2% of the total number of cases and 24% of the total number of those hospitalized. The total number of cases includes, again, the 721 total deaths and represents 1.7% of the total number of cases. This is also the county's case fatality ratio. In the next slide, skip 2 slides. Yes. The next slide reviews COVID-19 demographics related to hospitalizations. The 3,237 total hospitalizations show that the majority of these, which is 2,321, or 72% of the cases, are among people that are 50 years of age and older. Males represent the majority of those hospitalized at 1,746 cases, or 54% of the total number of hospitalizations, and Hispanics or Latinos represent the majority of those hospitalized at 1,868, or 62%. In the next slide, this speaks to further demographics related to deaths. 315, or 44%, were female, 406, or 56%, were male. 690, or 96% of the total death cases had underlying medical conditions, and 31, or 4% of the total had no underlying medical conditions. And as always, we would like to express our sincere condolences and sympathies to the families and friends of those who have lost their lives due to COVID-19. Next, let's move to the outbreaks. Since the beginning of the pandemic, 441 total outbreaks have occurred in 3 categories: skilled nursing facilities, other congregate settings, and community settings. Overall, all of the 4,932 cases that are associated with these outbreaks represent 12% of the 41,324 current COVID-19 cases. Of the total 441 outbreaks, 315, or 71%, are now closed and inactive, and that means that there have been no new cases occurring in these settings in the past 14 days or longer. This leaves 126, or 29%, approximately a third, of the 441 outbreaks as active outbreaks. Of these 126 active outbreaks, 25, or 20% of the 126 active outbreaks are in skilled nursing facilities. In this setting, there have been 881 residents and 584 staff with laboratory-confirmed COVID-19, and this includes 159 deaths. 31, or 25% of the 126 active outbreaks are in non-skilled nursing facilities or other congregate settings. In this category, there have been 954 residents and 652 staff reported, which includes 113 deaths. Lastly, 70, or 56% of the 126 active outbreaks are in community settings and represent 1,861 cases, including 13 deaths. Now, our triggers dashboard also includes a trigger for community setting, outbreak trigger, and this is the only trigger that is red on our out of our 13 triggers. Community setting outbreaks are defined as 3 or more laboratory confirmed COVID-19 cases that are epidemiologically linked and in different households with onset within the past 14 days. In this next slide, this shows all 264 active and inactive community setting outbreaks since March 25th by month. which accounts for 1,861, or 5% of total COVID-19 cases. Keep in mind, currently only 70 of the 264 community outbreaks are still active. As you can see in this next slide, the outbreaks will actually go back. Thank you. As you can see in this slide, outbreaks are highest for the months of July and August. Note that July has the largest number of outbreaks with 93 outbreaks representing 549 cases of the 264 community outbreaks. August is obviously close behind with 85 outbreaks representing 491 cases, despite state restrictions imposed beginning in mid-July. And the community setting outbreaks have slowed down for the month of September with 25 confirmed outbreaks to date. Now, this next slide shows the 264 outbreaks since March 25th by community setting. The top 3 settings of all of the 265 community setting outbreaks include 64 outbreaks in restaurants/bars, plus 18 in restaurants, for a total of 82 outbreaks. We have 75 in various businesses and 22 in healthcare settings. Today, we are reporting in the next slide 22 community outbreaks for the past 7 days from September 2nd to September 8th, which represents 103 cases. Today, 3 new community outbreaks were added, and this includes, in the next slide, 2 businesses and 1 restaurant/bar. Overall, shown here in the next slide are the 22 outbreaks by settings, which includes 8 or 36% occurring in various different types of businesses, representing the largest group of outbreaks for a particular setting. Now, last week, everyone is aware that the governor announced the Blueprint for a Safer Economy, which is intended to reduce COVID-19 in the state and consists of revised criteria for loosening and tightening restrictions on activities. The Blueprint for a Safer Economy replaces the county data monitoring list that you have been familiar with in the past. There are now only 2 primary metrics used for the monitoring list, and this is case rate and % of testing positivity. But also testing volume is important and is the first step to calculating these 2 metrics. Every county in California has been assigned to a tier based on the county's rate of new cases, which is calculated differently than before, and the % of testing positivity. So the state has calculated San Diego to have a case rate of 6.9 cases per 100,000 population and a testing positivity at 4.2%, which meets the threshold for a lower tier, the testing positivity, but because the case rate is in a higher tier, San Diego continues to be assigned to the red tier 2. So for your information on the Blueprint for a Safer Economy, please visit covid19ca.gov. Now, I just want to note that San Diego County is currently actively working with the state in order to address differences in testing volume results sent to and received by the state. And this information, we are working very closely with the state, and over the next 2 weeks, we hope to have this issue resolved. As we work through this issue with CDPH, our work locally remains vital to our movement to a higher tier. So it is imperative that all of San Diego County continues the best practices that we have espoused throughout this entire pandemic. Stay 6 feet apart from individuals, wash your hands, and promote sanitation practices. Wear your facial covering, avoid crowds, and stay home if you're sick. We all have a role in this regional ability to stay in Tier 2. So we do not want to go to a higher tier. We want our efforts to help us move to a lower risk tier. So now, please welcome back to the podium Chairman Greg Cox. Thank you.
Thank you, Dr. Wooten. Before we get into the questions, I just wanted to reemphasize 2 points. Anyone interested in getting a COVID-19 test, if you're interested to know where those locations can be on a drop-in basis, we encourage you to get on the 211 website, which is 211sandiego.org. And as Supervisor Fletcher and Dr. Wooten have indicated, the case counts now are going to be updated every Tuesday by the state of California, and we'll be reporting on those when we have the media briefings on Wednesday. Starting next week, we're going to be down to 1 briefing per week, which will be on Wednesday at 2:30, unless there's breaking news that would necessitate calling a special media briefing. With that, we'll go right to the questions.
The first call is from Artie Ojeda with NBC7.
Thank you, Chairman Cox. You sound great, by the way. Regarding the 400 cases connected to San Diego State, as you mentioned, the university has a proactive student COVID policy, but the presumption is that many of these cases are happening off campus. They're happening off campus. The university, of course, has hired a private security company. I know Dr. Wood has been out there. But what authority does a private security company, and for that matter, the university, have over off-campus activity? And what are, at this point, the county compliance teams doing to help out the cause?
Okay, I believe Dr. Wood is going to come up and respond to that. He's the Vice President for Student Affairs and Campus Diversity at San Diego State University.
Thank you for the question. I think it would be good to kind of recap everything that we've done thus far. So in our college area, which is near campus, what we've done is that we have prioritized having security that's in places, which was mentioned in the question. What the security is doing is that they are patrolling, looking for social activity, violations of health and safety policies, violation of our COVID-19 policies, and then what they do is that they intercede by reporting that to us. It goes into our system, and then we do direct follow-up with those students. We do have the ability to follow up with students via warnings and other notifications that can go to them. In addition to that, we also have patrols that are taking place, as you mentioned, by myself, and there's another vice president, as well as a number of our managers who've been out there in red and black shuttles. And what they're doing in those shuttles is using that during the evenings, and during the weekends in particular, looking for social activity, following the same process. We report it, we follow up through the university. So there's a lot of monitoring that's taking place. Second, in addition to all that monitoring, is the communication campaign that we have in place. We started that communication campaign long before we got to the fall semester, talking to students about the importance of wearing PPE, practicing social distancing, adhering to all the policies and the procedures that are in place. And then the third thing that we've done is also our stay-at-home advisory. So we had a stay-at-home order for students who are on campus, asking them to stay within their residence halls over the Labor Day weekend. We also had a similar advisory for the local college area, and then I have extended that advisory up through next Monday. It's important to know that these different factors are working. If you go into the college area in the evenings, you'll note that there is a significant reduction in the the amount of social activity that is taking place. All this is part of what we have put into place. As we've mentioned before, this is an all hands on deck approach, and what we are doing is working. It is resulting in much more limited social activity. And if individuals do become aware of things that are taking place in terms of parties or other social activities, they can report that to us. We do direct follow up. And again, in the totality of this, the important thing, which is what really matters, is that there has been a significant reduction. Thank you.
Okay, then on that note, can I follow up then and ask how many of today's cases are connected to San Diego State? Has the number gone up from the 400? And also, so what you're saying also, Luke, is that you do have jurisdiction over off-campus activity?
So I'll respond to the second part of that question and leave the first part of the question for the healthcare professionals that are in the room. I would say that we do have off-campus activity for certain types of activities, and so it depends upon what is taking place, what the violation is. We are certainly more restricted in our local campus community, but there are things that we can do, and there are measures that we, again, have already put in place, and those measures are working, and I think that's what matters the most. But yes, we do have some authority in the local area outside of campus, but it's for a very narrowly tailored set of violations. So we're following up, we're treating this as very seriously, and the good news is, and most importantly, it's working.
And I just wanted to give the answer to the other question you asked about the number of today's cases that are reported that were San Diego State students, and the number is 44.
And so that means there are now 444 cases connected to San Diego State?
There are 440 cases connected that are confirmed, and there are 4 probable. So that total would be 444 confirmed and probable. That's correct.
Thank you.
Okay, let's go to the next question.
The next question will be from Sasha Fu with KUSI.
Hello there, and yes, Supervisor Cox, you sound very strong. Your voice is very strong.
Thank you very much. Appreciate that.
This is a question for Dr. Wooten. You alluded to a difference between the county and the state on what you call testing volume results. So I'm going to take the liberty of reading a little bit into that. Is the state suggesting that the county is not testing enough?
Okay, Dr. Wooten.
Thank you, Sasha, for that question. What is happening is that we are aware, the County of San Diego is aware, that the state is not getting all of our tests. And we know where some of those locations are. So we are working closely with the state to map out the data flow process so we can identify where the glitch or where the issue is, because we know that the testing volume that they are assigning to us is not the actual volume of tests that we are conducting. Thank you.
So it sounds like this is a problem with data flow, information flow, not the actual data collection, because there's some concern that perhaps the state, if they were under the impression that the county was not doing adequate volumes of testing, that they might try to push the thresholds or the triggers and, I don't know, suggest that we're actually in a higher tier than we are?
Well, we're still in tier 2, and the collection, that's not the process. It is actually the reporting, them getting the cases, or rather the tests that are conducted here locally. So that's the primary issue, and we are working on that with the state.
You said that there were,
Okay, we'll go to the next question.
The next question is from Priya Sridhar with NBC7.
Yeah, this is a question for Dr. Wooten. You sort of were explaining this, but just to clarify, which state numbers matter more in officially determining our tier, the unadjusted case rate or the adjusted case rate? From my understanding, our unadjusted rate is 6.9, which has us in the red tier, but the adjusted case rate is 7.9, which would have us in the other tier, the purple tier. So, which would mean that our countdown clock had already started. So which one should we be paying attention to?
Okay, Dr. Wooten.
For further clarification, and thank you for that question, everything hinges on testing volume. The testing volume is used to determine the testing positivity, and the case rate is adjusted or could be adjusted if your testing volume is not at the level as prescribed by the state. Right now, our case rate is 6.9. That is the unadjusted, and that's where we are, and that's the state agrees that's where we are now until this whole process can be adjudicated. Does that explain and answer your question?
Yeah, can you just clarify what the 7.9 then is if we're meeting all the state's thresholds for testing?
So the state, and this may change, but they determined an adjustment factor. If you were meeting state average for testing or above, there's a factor that they use that helps to lower your case rate. If you were not testing to the state average, that number, the adjustment factor increases your case rate. So that's why you see that 7.9. But right now, all of that is on hold until we can identify what our actual testing volume is, because that determines the testing positivity, and if we are, that is used with the testing positivity, and if we are at the state average, then our adjustment would be a downward adjustment. But again, that could all change. There has been significant, there's been challenges and local health officers across the state are concerned about that. So we are still talking with the state, but right now, what is current is that we are at 6.9. That's what the state is accepting. That's what's on the web page and on the website. And we are working on this to try to get it resolved over the next 2 weeks. Thank you.
Okay, we'll go to the next question.
This question is from Brandon Lewis with Channel 8.
Thank you. I think you touched on most of this already, but I just want to know if you can quantify approximately how many tests the county believes that are not being included, and whether that would be enough to keep the case rate below 7 once the adjusted number is calculated after the adjudication process by CDPH. And if it is above 7, would that 14-day countdown toward Tier 1 begin on September 8th or begin the following Tuesday?
Okay, I believe, well, I guess we're not sure. Dr. Wooten may have a brief comment.
It would be premature at this time to give any numbers. All we know is that our numbers are not accurate, and we are working with the state to resolve the issue. Thank you.
And so would that resolvement be for next Tuesday then? Or would they change the number from this past Tuesday?
Dr. Wooten?
The plan is to work on this over the next 2 weeks, so we will see what next week brings. I don't know what next week is going to look like, but today we are 6.9, still in the red, Tier 2, and we will continue to work with the state to try to resolve the issue. Thank you.
Thank you, Dr. Wooten.
Okay, next question.
This next call is from Paul Sisson with the San Diego Union Tribune.
Thank you. First off, I had a question about the case totals at SDSU. 1 week ago on a Wednesday, the case total was 64. Now we are in 7 days up to 444. That's a nearly 7-fold increase in 7 days. Now that we're 7 days on, last week the idea was we haven't seen enough time pass to know, what rate this thing is growing at. Now that 7 days have passed, can we say more about whether you're worried that this thing is growing at a serious rate that indicates pretty much no social distancing, mask wearing, et cetera?
Okay, Dr. McDonald's going to respond.
Yes, thanks, Paul, for that question. And I know that's a follow-up from a question that you asked me, I think, last week. We're concerned about this number of cases. Obviously, it's a very large number in aggregate who are San Diego State students. Our investigations thus far look like there are a number of groups of students within that that may be separate outbreaks. but we're still investigating the connections between them, and it will take some time. And the important thing is when you identify cases, you need to be able to identify them quickly, identify their close contacts quickly, have them take action, get tested if necessary. And that is one of the reasons why the numbers have built the way they have. It's hard actually for me to estimate today how many close contacts we're following, because we've had a number of close contacts who we've urged to get tested, who have in fact been positive, then later developed symptoms. And so we know that we're catching these cases very, very early. And so our isolation and quarantine of those students, which is very, very effectively being carried out both on campus and off campus with the various groups that we're interacting with, we feel is in fact reducing the transmission. We won't really know that until down the road, as is the case with many outbreaks. And so I do feel that we are bending the curve at San Diego State. Certainly just anecdotally, case by case, these numbers will continue to grow, and we have a number of cases under investigation. And so I think while it's tempting to look at doubling times or the increased rate in this group, I think that it might be misleading to do so. You need a much bigger population to make that type of determination to be valid. And many of the cases we're finding actually had symptoms that started earlier than they presented for care. And so when we finally wrap this up at the end, we'll have an excellent description of what happened. But right now, I think that all of the proper steps are being taken to limit the transmission. And the students are being extremely cooperative. And I think, again, I feel confident that we are, in fact, lowering transmission, but we will learn about more cases.
Dr. McDonald, a follow-up. Yesterday, the case was that none of the 400 students who have tested positive have been hospitalized. Is that still the case now that we're up to 444? And if nobody's been hospitalized, what does this say about, what this outbreak situation is in terms of a danger to the overall community? If nobody's being hospitalized, then, how much should we really worry about this? It's not overwhelming the hospital.
Well, I think there's three components to that question. One is, are there any hospitalizations? And as of today, we can report that there has been one hospitalization in a San Diego State undergraduate student, currently still in the hospital. But the group of individuals who are getting COVID are in the group that actually does usually very well and doesn't usually need hospitalization, doesn't have significant morbidity or mortality. It's the 20 to 29-year-old age group that most of these students are in, and so they are tolerating this well. The issue is we don't want them spreading it to others. If we can keep it contained in this group, they're not in turn spreading it to vulnerable individuals in that age group who have medical conditions that make them vulnerable, or people who are older with medical conditions that make them vulnerable. So the fact that the students are able to stay in place, comply with the quarantine and the isolation, and in fact other students who aren't known to be close contacts also limiting their exposures will in fact lower the rate. And I'll also say that we do focus on deaths. That's the ultimate bad complication. But remember that COVID-19 has been associated with a myriad number of complications, and strokes, for example, heart conditions, some of which can be long-lasting. And we're learning that that can affect young people too. So I think we need to aggregate all that information together when we say, are we concerned? The last part of your question is that the community as a whole needs to take lessons from this, that by doing the things that we're asking the students to do, if they are doing those things in the public, social distancing, washing hands, not having social gatherings, that will, in fact, again, lower the transmission rate so we stay in the current tier and, in fact, are able to improve to better tiers later on.
And then this question is for the SDSU folks. On Friday, there was an update that there had been about 400 students who had been cited for violating public health guidelines. Could we get an update on that? Has that number gone up through the weekend?
Okay, Dr. Wood is going to respond to that question.
Yeah, so the number was 457 previously. We went up to about 500. We're again seeing much slowed activity in the college area as well as on campus. So it's gone up only slightly since the last time that we reported. Part of that is because all the efforts that we put in place are beginning to work, and we're proud of that. Thank you.
Thank you.
Okay, we have one final call-in question.
The last question is from Will Huntsberry with Voice of San Diego.
Hi, I was maybe hoping to hear from Dr. McDonald on this and get an epidemiologist perspective. The numbers, some of the numbers make it sound like things are ticking up generally in our area. The percent positive, the new cases. How would you characterize the trend of new cases right now and the direction we're headed?
Okay, Dr. McDonald?
Well, thanks for that question, Will. And actually, there was a slide of the daily cases with illness onset date. So if you can bring up that graph while I'm talking, that would be really great. If you notice the last number of weeks, there is a slight upward trend, and I think that that's how I would characterize what's going on right now, is a slight upward trend. There's the slide. If you look at those last 3 weeks or so and just kind of block out the big curve in front of it, you can see that there is a slight upward trend there. It's ever so slight, and I would say that that's the case, and I think that it's predictable, because what have we done in the last couple of weeks? Well, we've had some reopenings. We've had some increased student activity with the education, higher education, and we've just had a long weekend. And I would say that those things probably all will contribute to a slightly increasing trend over that's what's contributed in the last 3 weeks, and may continue to contribute in the next weeks ahead. So what can people do about it? Again, it's the simple things. If you just follow the instructions that are in the public health order: socially distance, wear a mask, do things in the social environment that are only essential, wash your hands, then we will be able to keep the number of cases where we are. But I would say that we are, in fact, having a slight increase.
And you mentioned, in a way that's to be expected because of changes we've made in the last few weeks, that slight increase. What would you be looking for that would be unexpected that might lead us to change the public health order again?
Well, again, I think that we need to be careful about looking at any one day. I mean, any one day sometimes can have a very high number or a very low number just based on things like reporting delays and number of people being seen. So I would be careful to be too specific day by day. And certainly we're concerned whenever we hear about clusters of cases or even one case in a specific congregate facility. We go in and we have a protocol that we rapidly test and assess and try to control transmission. I think that's something that our entire team and our community has actually gotten better and better at over the last number of months. But you always have to be careful when you ask somebody what they don't expect. I don't know. I don't know. It's not expected. So it's a tough question to answer.
Thank you.
Okay, that completes our phone-in questions. We do have, I think, 5 texted questions, and the first couple of ones are going to deal with San Diego State University. The first part of this one question, we're going to ask Dr. Wooten to come on up and respond to, and then we'll have Dr. Wood and Dr. Dooley respond to some of the other questions from concerning San Diego State University. So go ahead and ask the question, and Dr. Wooten, if you want to come up and respond.
Okay, so this first set of questions is from Claudia with Univision. The first question is, could the outbreaks at SDSU skew our positivity rates to the point where as a county we might be bumped over to a purple or white spot category, leading to possible closures in the county?
Thank you for the question, and certainly, yes, that is possible if the cumulative number of daily cases continues to, increases to a point that we were seeing in July, where we have 300, 400, 500 daily cases. So far, in the past 3 days for sure, and then in the past week, cases have been in the 200s and 300s. What we don't want to see is daily cases, 400, 500, 600, as we saw when we were seeing that type of daily reporting in July. So that's what could tip us back over into being in the purple, not back, but that could put us in Tier 1, which is the purple tier.
Thank you, Dr. Wooten. This next question, Dr. Dooley will step up to answer, I believe. SDSU students have told us that there were concerns over classmates that did not want to say they have COVID-19 over fear of disciplinary action or being sent to apartments designated for quarantining. Could you explain what happens to a student if they are positive case? Can students face disciplinary action, and how are dorms designated for students with COVID cleaned and maintained?
All right, thank you for the question. I am going to answer all parts to the best of my ability, and please help me if I forget any of those pieces. So in terms of the process, so we have worked really closely with the county and are cross-referencing the various lists that we have from San Diego State, testing that we're doing on site, as well as tests that students are taking from throughout multiple sites during the throughout the county. And so we have a great partnership and are able to contact students once we have been informed that they have tested positive. So our own understanding of our community has shown us that there were some students who were choosing not to get tested at our student health services because they were wanting to keep their test private because of how we're sharing information with the county. We are aware of those positive tests, and we are going in and supporting the county's efforts to contact trace, as well as our necessary efforts in our residence halls to determine where these students are living and to put them in the appropriate isolation location. That includes phone calls, texts, knocking on doors, so we do spend a lot of dedicated time once we are aware of a positive case to ensure that we get a student moved into an isolation location. In terms of enforcement, which was one of the components of the question, we do have the ability to utilize our code of conduct and do citations if students are not following their isolation or quarantine order. Students are informed as they learn that they need to go into isolation and quarantine to ensure that they're following the expectations, that they're staying in the designated areas, whether that's isolation, which means that a student will move to a new location, or quarantine, where they will quarantine in their current living space on campus. We have in our isolation area specifically, so we have 3 locations where all of our students who are isolating are currently located. And in those 3 locations, we have secured security teams to help with our professional staff in order to ensure that we're monitoring and supporting those students who are in isolation in those areas. We also have a process with our professional staff to check in with our students regularly who are in isolation and quarantine. For our isolation students, those check-ins are twice a day, and so we're checking to see how they're doing, making sure that they're healthy. That's one of our primary concerns with all of this, but we're also checking to make sure that they're doing what they're supposed to be doing. And so that is another course of action for us to gather information. In terms of our isolation locations and that process specifically, we had, when we started this process, set aside 130 rooms for isolation. We've learned that those, and when I say rooms, they're not individual rooms, but they're units, and these units are either apartments or suite styles, locations for housing. And so we have that designated inventory of isolation locations for our students, and we have expanded that based on need. Is there any components I missed? I'm sorry.
I think the only point that you may want to add to is the question about how these units are cleaned and maintained.
Yes, thank you so much. So we make sure that there is a thorough cleaning between each use. And prior to a student coming into one of these isolation locations, we do have linens and a number of toiletries, a number of other things that are placed in those rooms to ensure that the student has what they need. And we also provide food food deliveries, water, et cetera. And as I mentioned, those phone calls that we're doing that are twice a day for our students in isolation, we are identifying if there's something else that our students need through those phone calls. Thank you.
And if I could just add a brief addendum to all of that, I did want to say that the issue of cooperating with the investigators and getting tested when they think they might have symptoms, having some hesitations about that is not unique to San Diego State students. That's actually something that everybody might have some concerns about. I'll say that that's one of the reasons why we are doing this, our case investigations and our contact tracing with sensitivity to those concerns, ensuring that information that needs to be confidential is confidential. And I do want to really compliment the students at San Diego State because, frankly, they have been really more cooperative than I would say the average individuals that we deal with in terms of telling us about their activities, telling us about their close contacts, being very forthright because they understand that what they're doing is protecting their community, their classmates, and the surrounding area around the campus. So I do want to really specifically commend them for being as cooperative as they have been, and I feel that that will probably continue.
Part of the question from Claudia is, are a limited number of classes at SDSU returning tomorrow? If so, how many? Is in-person instruction set to return on October 5th?
Yes, just as a reminder, we did an instructional pause for 4 weeks after we saw the rise in cases of COVID-19. And that pause was really meant for us to be able to assess and reevaluate to determine the length of whether that pause would be extended or whether we would resume in-person instruction. There was, among the 212 classes that we had that were in-person classes, which was, again, a significant reduction from where we would normally be, which is thousands of classes. We were down to 212. All those 212 classes, minus a small subset, were subject to the pause. There's about 30 classes that have been included as being an exception within that pause. And for the vast majority of those classes, they are either for licensure or based upon accreditation needs, still need to be in person. And the majority of those classes have 8 students or less who are enrolled in them. So we feel like those, based upon those factors, were ripe for an exception. Thank you.
And Dr. Wood, the next set of questions is from Jack Malmood with News 8. Can you give an update on quarantine space offered on campus? How many rooms are being taken up by how many students? Also, is there an update to the amount of health violations issued, and have any of them led to expulsion or suspension?
Hi, so in terms of quarantine, we have 136 students who are quarantined in our residence halls. We have 169 in isolation. So, and the isolation students are the ones who have moved locations and are in the isolation-only facilities. The quarantine students are remaining in their residence halls.
And then, as mentioned before, there have been around 500 individual and organizational actions that have taken place. A number of those have already received outcomes as a result of our process. At this point in time, there are certainly those, well, I should say that the actions themselves can range from a warning to probation to a suspension, even in an extreme case, an expulsion. At this point in time, we're not commenting on what those outcomes are. Thank you.
Well, we just got through Labor Day, but already we're having questions concerning Halloween. So I'm going to ask Dr. Wooten to come on up and be prepared to respond to this question.
This is actually a question several reporters have asked. I'll read this one from Mario Sevilla with 10 News. With Halloween weeks away, Los Angeles is not allowing trick-or-treating this Halloween. They're also disallowing parties and events. Will you be issuing a similar order? What is your guidance for organizations planning holiday events? And if not now, what is your timetable for making that decision?
Well, first of all, we've just learned that Los Angeles has rescinded their banning of the Halloween festivities. And during the cloud of the pandemic, we have to get joy where we can. So we will be awaiting CDC guidelines, but we'll be coming up with a process or protocol. For example, drive-through Halloween event to allow children to don their Halloween costumes. And we plan to probably have that codified by the end of this month. But right now, there is no discrete plan. Thank you.
Dr. Wooten, if you could stay up there. This next question is from Lemur Abrams with CBS 8. We've seen dramatic video over the weekend of massive parties in Mission Bay. Researchers are already worried about these types of super spreader events. How worried is the county that the parties could contribute to a new spike in cases? And can you tell us why there wasn't greater enforcement to prevent such parties? We were told 2 people were arrested, but police will not provide us additional information.
Well, first of all, we are always concerned about gatherings. That's the reason every time we engage you that we talk about those practices that can prevent the spread. And gatherings is one of those, meeting in large groups, particularly with individuals outside of your household. So each jurisdiction has the authority to police the events that are in their area. And we also, as you are aware, have our county's compliance team, where if individuals or entities report gatherings, I even get individual complaints over email, and we pass that on to our compliance team. So we are doing all that we can to work with the various jurisdictions and also to conduct the assessments of issues that are brought to our attention. Thank you.
As I mentioned at the beginning of this media briefing, we've got a couple of different crises going on at the same time. This next question has to do with the evacuees from the fire and the hotel rooms that they're using. And we're going to ask Gary Johnson, who's our Chief Resilient Officer, to respond to that question.
And this question is from John Carroll with KPBS. Do the hotel rooms being occupied by the fire evacuees right now affect the amount of temporary shelter available for people experiencing homelessness?
John, thanks for that question. The short answer is no. As of noon yesterday, we had 360, a little over 360 evacuees housed across, or in 9 hotels across the entire county. Those hotels were identified and contracted by the American Red Cross with the assistance of our department, our county department of purchasing and contracting, but no impact to our requirements to house and care for our homeless. Thank you.
We have one final texted question, and I think I'll try to respond to that question.
This one is from Mike McKinnon with KOSI. Businesses that haven't been forced to permanently close haven't operated as normal for nearly 6 months. Besides Supervisors Gaspar and Desmond, is anyone from the county working to get Governor Newsom to allow businesses to reopen quicker than his guidelines allow, or does everyone support his guidelines?
Well, I can't speak for each supervisor. I can only speak for myself, but I think clearly, we want to get businesses opened up as quickly as we possibly can, as long as it's safe. I know about a month ago, Mayor Faulkner and I wrote a letter to the governor encouraging some further guidance to allow businesses to open up. Obviously, there's been a lot of things that have happened in that intervening month. We've been able to get schools reopened. We've got new guidelines, new tiers that are being established. I have to tell you, the governor has a very, very difficult job to try to balance reopening of businesses in California, at the same time trying to make sure that the public health of all citizens is protected as best as we can. So I've been very supportive of the governor and his efforts. I obviously want to see businesses open up as quickly as we can. I think we've seen some encouraging changes just within the last week, particularly for barbershops and beauty salons and restaurants having a greater opportunity. It's all going to be a result of what happens with the number of positive cases and the ability to track down those that are testing positive and getting them into treatment. And, you know, we hope although we've maybe had some minor setbacks or maybe some major setbacks this last week in regards to the number of positive cases, that we can continue to see a downward trend and go into the next tier, which would be tier 3, which would be the orange tier. Hopefully, I hope I'm not too optimistic that we can get there in the next few months, but a few weeks, hopefully. But, you know, we want to get businesses open as quickly as we safely can be reopened, and that's going to be the key word, making sure that the safety of the citizens of San Diego County are protected, at the same time allowing businesses to responsibly reopen. So that completes our questions for today. We are not scheduled again for another media briefing until next Wednesday at 2:30. However, next week is going to be a very busy week. On Tuesday, the Board of Supervisors is going to have our regular meeting. We'll have some updates at that time in regards to these different case numbers and tiers and other issues that have been raised today. We'll get a thorough update at that meeting, and the board's going to consider approving economic stimulus grants to over 2,029 local businesses. Total dollar amount that will be allocated at that meeting is $14,592,749 that will be provided in economic assistances to businesses that have been very stressed as a result of this COVID-19 pandemic. This is a big part of our efforts to support local businesses that are struggling during the pandemic, and we look forward to helping them out as best we can. We will report on that and other actions at the media briefing next Wednesday at 2:30. Until then, please stay safe, San Diego. And again, we want to thank Dr. Wood and Dr. Dooley for being with us here today from San Diego State University. Thank you.